Good morning, all participants. The event will start shortly at 10:15. Please keep all your audio muted and wait for the discussion to start. Good morning, ladies and gentlemen. It's my esteemed pleasure to welcome each and everyone present here on behalf of PhD Institute of Medical Sciences and Research to today's panel discussion, The Road Less Taken, conducted as a part of AXON 2020. Hello and welcome. I would first like to take this opportunity to welcome all our panelists, proud alumni of PSG, and all our eager and aspiring medical students and graduates taking part in this discussion. Do not go where the path may lead. Go instead where there is no path and leave a trail. The road less taken. The topic of interest of today's discussion offers a glimpse into the various possibilities for an MBBS graduate's future instead of the plain old stereotypes. One of the benefits of conducting a webinar is that we are able to transcend time zones as we are joined by our esteemed panelists from all around the world. And without further ado, let's get started. First with us today, we have Dr. Shilpa. Captain Shilpa is an Army medical officer currently posted at Jammu. She did her MBBS at PSG IMSR, passed out in 2017, and joined the Army the very same year. She did her medical officer's basic course in Lucknow and has been posted in stations at Jammu and Dehradun. We welcome you, ma'am.
Hi, are you able to hear me?
Yes, ma'am.
Okay, and you're able to see my video?
Yes, ma'am.
Okay, because I cannot see anybody, I thought I am not.
Hi, Shilpa, I'm here.
Ajata, hi, ma'am. How are you, ma'am?
I'm good. How are you?
I'm good, ma'am. I'm good, ma'am.
Yeah, so good to see you.
Thank you so much, ma'am. Thank you for giving me the opportunity, ma'am. Hello? 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 Hello?
Yes, ma'am.
You can hear me now?
Yes, ma'am. We can start.
Okay, so I will just start. Hello everybody, I'm Captain Shilpa, now at Jammu. I was a batch of 2011 at PSG Institute, and I did my schooling in Chennai at Rosie Matriculation Higher Secondary School. So I joined PSG in 2011 and I did my MBBS there, and I completed in 2017. So after 2017, I was actually preparing for my PG, and that is when we had Dr. Priya in a surgery department. She was my AP when I was doing my internship. She was a short service commissioner in the army, and she retired as major. So she gave me this idea of joining the army after MBBS, and she guided me through this interview and all the application process. So after I came out of my MBBS and my internship, while I was preparing for my PG at Thrissur, my interview was in August. So around July, I had applied through the online application, and they had called me for interview in the month of July. So I gave an interview for joining into the army. We don't have any written exams. We only have an interview and the medical. If it's very transparent. Your result will be declared on the same day of the interview. So after that, you'll have to stay put in the place of interview, like it may be in Delhi, Kolkata, or Bangalore. And for 2 days, you'll have your medical. Once you've cleared your medical, then in a month, they'll give you a call letter as to where you have to join. So after I got selected in the interview and my medical was over in the month of July, August, they sent me a call letter asking me to join by the end of August. So then my first station was at Jammu, and I got commissioned there. I got my rank there as captain. Usually, doctors who had completed their internship in civil, other than AFMC, that is Armed Force Medical College, we get commissioned directly as captain. But those who have studied in AFMC and have done their internship in AFMC, they get commissioned as lieutenant. So once I was posted in Jammu, I did my 3 months there at a military hospital in Jammu, and then I was sent for my medical officer's basic course, which is a course of 7 weeks where you will be told and taught and practiced only about the army life. We won't be practicing medicine for that 7 weeks. We'll only be trained for and marching and games and all the infrastructure of the army and of other units like the infantry, artillery, which you must be seeing on news, where they fire with weapons and tanks. So for 7 weeks, we'll have a course there, after which we'll be designated to other hospitals or other small hospitals. So from my basic course, I was posted to Dehradun, which was a smaller hospital, for 9 months. After which I was again reposted back to Jammu here, a little far away from Jammu in another small hospital. So here now it's in the small hospital at Jammu. I've been here for 2 years, and here what you get an opportunity is you get to see things which civilians do not get to see. Like you get to go to the forward regions, you get to serve with the troops there. You get to see the other countries, our neighboring countries, and their army setup and the troops there. You get to see how difficult life is sitting on that border. It's almost equivalent to lockdown. Lockdown is a smaller version of it, where you just get to sit in your house and you don't get to go out. It's the same thing there. For them, house is a small bunker type, which is built with stone and mud, and you have only one view, and that is the neighboring countries like Pakistan and China. Otherwise, there is no internet connection, and you just get food for 3 times a day, and there is no other luxury there. So what army will teach you is to see life from a different perspective, which we only hear, but we get to experience it. And once you have seen all this, you feel that what we do at civil hospitals, or when we work at civil hospitals, it is a completely different environment and completely different luxury when you come and work in the army. You'll be able to see that difference a lot. So that something which you must experience, if you ask me. And another added thing to it is that you get the pride, you get the privilege to be as an officer here, because here doctors are treated like really life saviors. Because when a troop goes to fight in the forward region, or when he goes to defend our land or the border, his belief is only in one person, the doctor who is guarding behind. He goes with the belief that if something happens to him, he will be recovered, or he will be saved or treated by the doctor behind. And only with that belief, he goes and stands and gives his life. So that responsibility is completely different to the responsibility we see in the civil region. And other things which is good in the army is you can explore so many other areas. You get the privileges to travel. You'll be posted in different areas every 3 years. It's like 2 years of field with 1 year of peace posting. Peace posting come in cities and in the middle of India, and field postings come along the borders, like the western border, eastern border, and the northern border. So that is another thing which you must experience. And I must tell you, when the internship and the years I worked at PLC has actually helped me to communicate and to be a really better person in the army. My college and my alumnus and my teachers back at PLC has helped me a lot to see things, to treat things, and to look through the patients and give a better service to the troops. So our college is actually best to help us communicate and to teach us how to communicate with patients. So that is something which PhD will teach you, and you should hold on to it. And especially the teachers there. It is when I talk to my fellow colleagues who have come from different college setups, I see that we have got almost everything which they haven't received. So PhD is one of the best institutes, and you must be lucky to have been working and staying there. And so that is another thing. So this army life is something which has a lot of difficulties also to it. There are a lot of privileges to it, like you get to be an officer, you get to be respected wherever you go. You have the privileges of making your parents dependent on you. Your medical services is free for your parents and yourself. If you have children, then your children's schooling will be funded by the army. So there are a lot of privileges to it. But at the same time, there are a lot of difficulties which also come along with it. So Only if you're ready to go through that, join the army, because I have seen many of my colleagues who after joining army, they want to leave because they cannot cope up with the stress here. So one of this is if you're posted in Jammu or tension areas like the eastern and the western northern border, you may experience your communication is lost with your family, because you must have heard when the Article 370 came out, Jammu and Kashmir, the entire Jammu and Kashmir was devoid of internet. So we had to deal with it for 6 months. So you can imagine 6 months without the internet, especially in this era, it was very difficult for us. And if you are posted in forward regions, especially male medical officers will be posted in at most forward regions. Not female medical officers do not get their opportunity to go that much forward. So male medical officers will have to just go forward, and there'll be no internet, and you may receive casualty every day. So that is one stressful condition where you must be ready to work with. And there is a posting of Siachen. I'm sure most of you must have heard this highest altitude Siachen glacier. So male medical officers will be posted there. You'll be posted there for 2-3 months, where there is completely no communication with anybody. The food is just canned foods, and there is no internet, and you have to always roam around with 3 layers of clothing and with your thick boots and your gloves and your hair cap, and you have to sleep with that. And so that is one tenure, high altitude tenure, which is very, very difficult, and which has to be undergone by male medical officers. So that is one thing you need to face if you are going to army. And of course, there are other hierarchical issues which come here. Like you see in civil only, you have your seniors and you have to little abide what your seniors say, whether they're right or wrong. Maybe you can, you will be able to change it as you pick up rank, but when you enter, it's a little difficult to hold on to it, because here they test the mental, the limit, they'll push you to your limits, and you will see if you're able to go through it and sustain at your highest limit. So that is one thing which you should be ready to face. But if you ask me the benefits, the pros and the cons, the privileges you get here and the way they treat you, I think if you see all these little issues which you have, you'll be able to live with it here. And then you'll be able to get the grip of the army. I think I've spoken for 10 minutes or more. Hello?
Thank you, ma'am. A reminder to the audience to please keep your audio muted, and any queries can be directed to the chat. Your queries will be conveyed to our panelists and will be answered at the end of the session.
Hello. Any questions? Hello? Nobody's asking questions?
Does anyone from the audience have any questions? Ma'am, they've asked, is Hindi needed?
Yeah, what are they asking?
Is Hindi needed?
If Hindi, no, not needed, not needed. I was a person who did not know Hindi. I just knew basics like what is your name, my name is, that's it. So Hindi is not required. You will always be able to come here and learn Hindi. I was able to learn Hindi in a matter of 3 or 4 months, but there are so many officers who still just struggle with Hindi and have lived through the army. So Hindi is not required. It is not mandatory that you should know Hindi.
Another question is that, is joining NCC during MBBS beneficial for joining the army?
Yes, it will be added plus point to your resume. Once you know that you have been a part of, it's just an added resume. It's not that if you weigh 2 individuals, one has done NCC in the college and the other has not done, they don't select or they don't prefer NCC. It's not like that, but it's just an added plus point, because being in NCC, it means that they have seen 1% or 2% of the army life, the discipline, the punctuality and all that. But an individual can always be punctual and always be disciplined even if they have not joined
NCC. So it is not required, or it doesn't assure you that you will be selected, but it is just an added plus point.
What is meant by short service commission?
See, short service commission is there are three types. Okay, one is that you can you can do service in the army for 5 years, leave after 5 years, and take your NEET. You always have to write NEET even if you're in the army or you've left army. So take your NEET as ex-serviceman. I'm sure there's a quota in the NEET application mentioning ex-serviceman. Okay. Another short service is that you join the army. You don't do if you don't prefer to do PG. If you just want to be a MBBS graduate, so you can join the army and try for PG. There's only 3 attempts. They have changed it recently. Usually we had some few attempts which we can give to acquire PG, but now they have cut shorted to just 3 attempts. So in case you have given all your 3 attempts and you did not get PG, so you can if you don't get PG, in that case, end your service to 10 years from the date of. If I joined this year in 2020, so I can work till 2030 and then leave. That is second type. Third type of short service commission is you join the army. After 4 years, you give your NEET in service and you will get your PG. Do your PG for 3 years, and after that, work 14 years. Okay, so total there'll be 14 years. 4 years of being just a medical officer with 3 years, 7 years of your PG, followed by the rest of the years as a specialist. So after 14 years, you can leave the army and work outside as a specialist, but you will not be given. You are not pensionable after 14 years. Permanent commission is when you serve till your age of retirement, and that will be pension.
Ma'am, another question we have is, when are we eligible to apply? Right after internship or during internship? And what is the procedure of admission after? Sorry, ma'am. When are we eligible to apply? Is it right after internship or during internship? And what is the procedure of admission? Okay, actually, this is the case. You should have completed internship before you give the interview. Okay, so you can, there are, when I joined, that is 3 years back, there were 4 sets of interviews that happened. One was at Delhi in the month of July, August, and then after 3 months, you had it at Kolkata, Bangalore, and I think there's another place, I don't remember. So there were 4 sets of interviews. But nowadays, I think the sets of interviews have reduced. Maybe 2 is happening. So there is a website which is armysscentry.gov.in. I will repeat, AMC, SSC, Short Service Commissions, SSC entry. .gov.in. So you just have to get into this website, keep an eye on when is the next interview, and apply according to your convenience. That is, you should have completed your internship when you're giving the interview. So when you're giving the interview, you should have your completion certificate and all that. So that is what is important. So what I will prefer is just go with the website and see if you have an interview immediately when you have completed your internship. Because applying during internship and still you'll be doing your internship when you get selected, they're not going to select you in that case. Ma'am, can specialist doctors join army hospitals like INHS, ASVINI after their post-graduation?
Specialists are given more preference, actually speaking, than medical officers. Medical officers are also required, but if there are excess of medical officers and they are conducting interviews, so they will go for specialists. So yes, specialists can join. Depends on what specialty. They may ask you your choice of posting where you want. You will still fill it up. They'll give you 3 choices of posting you can fill, but again, it depends on the vacancies whether they will give you the choice of posting. So specialists can join. They have more privilege. What is it for specialists is after you join for 1 month, you will be doing basic MBBS duties like seeing MI room, so that you get oriented to the army. Then you'll have your grading, where you will be graded as a specialist, and then you will be working as a specialist. So yes, specialists can join them.
Ma'am, what can we expect in the interview, ma'am? Ma'am,
what was your next question?
what can we expect in the interview?
Yeah, in interview, it's basically 50% of your medical knowledge and 50% of your discipline and the way you walk in, your dressing sense, your way you have maintained yourself, the way you communicate with them. So, in medical, if you ask me, they will ask you only basic emergencies. How will you deal with a chest pain patient, or if you're a lady officer, they may be a little prone to ask you gynec emergencies and basic investigate or basic procedures, what we do like ECG or echo and all that. So actually speaking, I was able to clear all my medical questions only with the knowledge I acquired during my internship. For example, they asked me, what do you find in an echo? So we must have got 100 opinions, 100 times opinion from cardiologists after doing an echo for a surgical patient. So and then they asked me what will be your differential diagnosis for ear pain, and then they asked me obstetrical emergencies of preeclampsia. So medical questions is something which you will be able to clear if you have actually done your internship well, if you had actually learned from every patient you see in each department. Otherwise, the other side is when you walk in, you ask excuse, and then you sit only when you are asked to sit. And when somebody is questioning you, you have to look into their eyes and answer. And be honest. If you don't know, just say you don't know. Not an issue. Okay. So that is where they will judge you more. And always wear formals when you go to an interview. Many individuals, both boys and girls who had worn jeans, were not selected because the way you dress speaks a lot. If you are wearing casuals, they will think that you are taking this casually. Yeah. So, but if you are wearing formal and if you want to get it, so you will put in your best effort for your clothing. So that is very important. And of course, mannerism and punctuality, and it's a lot of things where they judge you whether you are fit for the army. So medical knowledge is only 50% of the interview. The rest 50% is your personality.
Yes, ma'am. The next question is, what are the specialties mostly preferred?
It depends. If everything is available here, you're asking me which specialist will be recruited into the army, or after joining the army, which specialty is preferred? I didn't get that question.
The question asked was, what are the specialties mostly preferred?
That is to recruit into the army, I guess. Then, huh?
Yes, ma'am. I assume so.
Yeah. So there is nothing like a specialty preferred. Every specialty is important here. Let it be psychiatry or radiologist or a dermatologist, non-clinicals, clinicals. There's nothing like preference. It always depends on vacancies. How many surgeons are here? How many medical specialists are here? So there's no preference as in who will be picked and who will not be picked. Every specialty in army is important, equally important. So there is no specific preferences here.
Yes, ma'am. The next question is clearing 2 sets of interview enough, or will there be a written exam also?
No. As long as I know, of now, there is no written exams. Only there's an interview, and after your interview is cleared, you'll have your medicals, which is very, very important because most of them get disqualified because of the medicals. You should be fit. Your weight should be within your limits. There is your BMI should be perfect, preferably in the lower range. Now the revised BMI, I think it is from 18.5 to 22.9. So please make sure that your BMI is in the range of 18, 19, 20. That is more preferred because armies are very stringent when it comes to weight. And they will have an ultrasound. Make sure the ladies don't have any fibroid uterus, and you do not have hemorrhoids and keloid, and you make sure your BP and your sugar levels are normal. So medical is where actually you get disqualified. Baki interview you will be able to clear easily. So there is only an interview and a medical. There's no written test.
Yes, ma'am. And the next question is, can doctors in the army have their own private clinic?
Sorry, can doctors?
Doctors in the army have their own private clinic?
No. Doctors in the army cannot have a clinic. They are not entitled to have that. And they should only work in the army, and you will not be able to have time to have a clinic. First of all, it is not authorized, and you will not get a clinic.
Yes, ma'am. And next is, after clearing the short service commission, is there an opportunity to get a postgraduate seat in an army hospital itself?
Yes. After doing your short service, in 4 years, you'll be writing your NEET, and you have to clear your NEET, and then you'll be able to get a PG. You will do PG in army medical, army colleges.
And what are the chances of getting selected, ma'am? What are the chances of getting selected and the number of seats?
See, it depends. It changes every year because initially there were short of medical officers, so they had kept frequent interviews. Now, I don't know. I think there are enough medical officers, so they have reduced the interviews. So it is not about what are the chances. It varies every year and it varies in every interview. So that I cannot make sure. But what I ask or I will tell everybody is give it a shot. Do your best, give your best, and don't go with the expectation of that you will get selected. Just go with the expectation to explore a new dimension of the field, so that if it gets selected, well and good. If you don't, then maybe you can see, depending upon the next vacancy, whether to give a next one.
What is the daily officer of a medical routine, ma'am, timing wise?
So it depends. It varies from hospital to hospital. Like, for example, if you're posted in a big hospital where there are specialization, where there is a surgical department, medical department, and all that, you will have to report or you'll have to go to the hospital at 8:30. If you're a medical officer of the department, you'll have to maybe go half an hour earlier to go and see if the patients are okay before the specialist comes. You'll work till 2. 2 is the OPD days or 2 is OPD timings. If you're working in a department, then it may extend to 3. It depends. Like, for example, when I was posted at Jammu MH, my timings used to be from 8, sometimes to 3:30 OPD, depends on the OPD or the emergencies at the wards or the ICUs. Then I have to go back again at 5 to have an evening round and come back by 9:30. So it depends where you're posted. If you're posted in the forward regions, where you're the only doctor, just hold on. I'm so sorry for that. So, yeah, the timings, if you posted in a forward place where you're the only doctor, there is no specific timing. So, you may get a casualty, battle casualty in the afternoon. You may get at 2 o'clock at night, 3 o'clock at night. So, there's no specific timing. But the rest of the time, you'll be free. You'll be able to just relax, and there is no other commitments. If you're posted in a field hospital where I am posted, then the timings are again morning you go, you have OPD till 2, and then evening you may have some office works, Adam works, some there is equal amount of documentation, Adam work here, and equal amount of professional work here. So I cannot give you specific timings, but it changes. It changes with the location, it changes with the hospital, and it changes with the situation.
This is another question. With the new next pattern, would this affect the pattern of selection? Because we have 2 next exams before and after the internship.
New, you mean to NEET pattern?
We have this exam called Next coming up, ma'am. One session conducted during before the internship and then after the internship. They want to know whether it will affect the chances. I mean, will it affect the selection?
I don't think it will affect the chances. Because your army will obviously get your mark sheets of all your years, but at the end of the day, it's how you perform on that day of interview that matters, not how you have done your exit and other exams.
And do we have a fixed number of chances that we have to appear in the interviews, or is it unlimited?
No, it's not unlimited. It depends on your age also. I think, I don't know how it has changed now, but when we were there, we could give a chance of, I think, 3 attempts. Or I think the age limit was around 35 before you could join. So it may have changed. That is what I'm telling you. See, even I am not updated because I've been 3 years and it keeps changing. The only way you can keep updating yourself is with that website. It's amcsscentry.gov.in. So if you go into this website, you will be able to get a detail of when is the next interview, what are the eligible criteria, and what are the requirements. So that is the best shot you have.
Okay, ma'am. And what can we expect in terms of pay for short service commission?
The pay is the best part of Army. Most of them, I'll tell you, AMC, SSC, dot, there's no dot in between SSC and entry. It's everything is in small, okay? It's AMC, SSC, entry.gov.in. Yeah, so pay scale is the best in the Army. When you get commissioned, your basic pay is 61,000. You will get a non-allowance pay because you're not allowed to practice outside. So yeah, that's correct. So you'll get a non-allowance practice NPA of around 10-12,000, and you get a transport allowance of 4,000. You will be given allowances in places. For example, I am in a counter-insurgency area, CI ops area, so I'll be given that allowance. If you're posted in the east and eastern border and northeastern border, that's a little high altitude. It's a little high above the sea level, so you'll get a high altitude allowance. If you're in proper field along the border, so that allowance is higher. And if you're posted in Siachen and glaciers, so that's a very high allowance. If you're posted in city, you will get city allowance. So allowances are more, and pay scale is very good. You will be earning around 80 or 90,000, including all these allowances and NPS, when you join the Army.
Holidays or vacation, and can we take leave for any personal reasons, ma'am?
Yeah, you have privilege of taking 60 days annual leave, where it depends on each heads. Here we call, like how we have our HOD, Dean of the hospital. Here we have a senior called commanding officer. So it depends on the CO how he gives it. Some COs give it as 20-20-20. Some give it as a 2 split of 30 and 30. So annual leave per year is 60 days with 20 days of casual leave. So this 20 days, you can take it as 5-6 days, and depends on where you're located. If you're located far away from your home, just take it, relax in your home. Or if it's near to your hometown, so you can come and go. And personal issues, yes, if it is a necessity and if it is an urgency, they will definitely send you on leave, no doubt about it. And it again depends. For example, if you're stuck up in a situation like the recent Balakot airstrike that happened, and Article 370, and now the COVID. So in situations where unless and until dire necessity happens, they will not send you on leave. They may hold you back, and it's a little difficult. But otherwise, on normal occasions, your holiday is always given. You can always go, and if you have any personal issues, you're definitely given holidays, no doubt about it. Again, it depends. If you're posted at high altitude regions or in along the borders where there is tension, then your leave may become a little doubtful. But not every time. It's like 80% you will get to go on time or for your holidays, but the next 20% is it depends on the situation and the place you are in.
Audience, do you have any more questions? Okay. Can we travel abroad, ma'am?
Yeah, you can travel abroad during your holidays, but you should get clearance from the organization. That's not a very big procedure. You just have to, there's an application, you just have to fill it. It will be signed by your higher seniors, and they will give you approval, no doubt. You can travel abroad, but only with clearance from the organization.
Audience, do we have any more questions for ma'am? I'm sorry, can you rephrase that question? Can we study there? Okay, ma'am. The question is, can we study abroad?
Can we study abroad when? After joining the army?
Okay, so they're asking if we can study abroad, and will the army allow for that?
See, if you want to take a fellowship, if that is what you mean, if you want to take a fellowship or any 2 or 3 years of a short course of other specialization abroad, you should be a PC doctor. You should be a permanent commission. So only after you get your permanent commission and maybe after your specialization, they will allow you to take a fellowship abroad. Being a short service, they will not allow.
And they're asking, how about residency or PG, but not fellowship?
No. Residency or PG is only allowed to be taken in India in army colleges. Not even outside, not even the other colleges which are not army based.
The question is, should we compulsorily use army accommodation and food?
See, it's not compulsory. You won't have another option. Okay. First of all, if you're a single member, not married, then you are allowed to stay only in the army premises. If it is field postings like Jammu and western border and eastern border, you will not be allowed to stay in the civil, and you yourself won't prefer to stay in the civil because it is not safe. And food, I don't think you will want to have non-army food because army food is actually the best. Okay, so if you're a family member, you're married and you are having accommodation, then they'll give you the ration. Ration is provided by the army, nothing to pay here. So they'll give you the ration and you make your own food. But if you're staying within the unit premises, then they will give you food. I'll tell you, food here is awesome. You will not say no to it. And when you're posted in peace, then you can have an option of staying outside. It depends again how close you're, because when you're called, you'll have to fall back immediately. So basically, once you get in, you'll only prefer to stay in the army premises. And here, if you are staying in the army unit, everything is free. So I don't think you will go out to stay. Your electricity and your water, it's all not payable. And when you're posted in field places, it is not safe for you to stay outside. It is not safe to reveal your entity as an army officer or you are in the army. It is always safe to stay silent and be within the safety premises of the cantonment.
Thank you, ma'am. Audience, we'll now stop with the questions for now. Any further questions can be emailed. The email will be placed in the chat box for you.
Okay.
Thank you, ma'am. Any further questions can be emailed to axon.phimsr@gmail.com, and we'll proceed with the next speaker.
Okay. Thank you so much. I hope I was able to give a little insight to what army life is. I don't know if I've covered everything. So if there's anything, do email him the questions and I'm sure he will communicate with me. But if you want to really explore another dimension of the field, then of the professional field, and this is one among it. You should, if you really want to go. Thank you so much for the opportunity. It was really good talking and exploring ideas with you all. And hope I have helped you and served the purpose of this meeting.
Thank you, ma'am.
Bye.
Thank you, Shilpa. Thank you, Shilpa, for being here.
Thank you so much, ma'am. Thank you so much for remembering me and putting me as a part of this. And thank you, ma'am.
Bye.
Next today, we have with us Dr. Soshita Jagadish. Dr. Soshita Jagadish holds a postdoctoral position in infectious diseases modeling at the Institute of Social and Preventive Medicine, University of Bern, where she focuses on the epidemiology and transmission dynamics of emerging infections such as COVID-19, Zika, and antibiotic resistance in STDs. Having recently completed her PhD in emerging infectious diseases at the Institute of Research for Sustainable Development in France in 2020, she enjoys using a One Health approach in spatial modeling. She graduated with a master's degree in tropical medicine and infectious diseases from the Liverpool School of Tropical Medicine in 2016 and holds an Mbbs degree from PSG IMSR. We welcome you, ma'am.
Hello. Perfect. I hope I am audible. I'm sorry about the video quality. It's 3 o'clock where I am, so it's quite in the middle of the night. Apologies for that. I will start with a small presentation. Let me share my screen with you. Let's see. There it is. No, that's not the one. There you go. And so can you see my screen? I hope you can.
Yes, ma'am. Screen is shared.
Yes.
Perfect. Thank you so much. Perfect. Oh, thank you, Dr. Ramlingam, ma'am. Thank you so much for this opportunity, and thank you, AXON, for letting me speak in this event. It's very special to me, and I'm quite honored and very, very pleased to be able to share my experience with you. So, my presentation is how I took a scenic route to become an infectious disease modeler. So that's what I do right now. And let's start with the presentation. So my journey so far, I graduated from PhD IMSR in 2014. So I was from the batch of 2008. So, and then after that, I pursued my master's in infectious diseases and tropical medicine in Liverpool School of Tropical Medicine. After which I went to Sierra Leone in West Africa during the Ebola epidemic to work a bit during the epidemic in 2016, and then later with the survivors of the epidemic in 2017. After which I pursued my research, of course, went into my PhD in emerging infectious diseases. So I started my PhD in French Guiana, which is a French territory of France, in the Amazon. So it is a part of the Amazon rainforest. It's a very well preserved country, very beautiful country. And I did 2 years of my field studies and field epidemiology in French Guiana, and after which I went to Montpellier in the south of France to complete my PhD. And then I have recently, I took up a postdoctoral position in infectious disease modeling in Bern, in the University of Bern. All right. So I had a very good start. I had a jump start, I could say, to start off my research career. I was the best outgoing student, so that helped me to convince my parents that I do not want to go into a clinical field. Which is quite hard to convince, and that I didn't want to get married at that point of time, and I wanted to pursue my research career abroad. And I also got a scholarship into the Liverpool School of Tropical Medicine the same year, which really helped me to convince them to take up a career in research. So I joined Liverpool School in the year 2015, after which I went into the field research in Sierra Leone. And by that time I was around 25, 26, and it was hard to work in the field. It was a harsh dose of reality, basically because you were working with people in a new region where with a disease which is quite deadly, with a very high fatality rate, which is quite traumatic as well. And then I realized that, and at that time, I was 25, 26, and what we would call a quarter life crisis or a mid-20s breakdown. So, because until then you are quite well protected in universities, whether it was in PhD, you have your parents with you, and then in masters as well, you're quite well protected. And so when you quit that environment, you're at your most vulnerable, because you feel it's quite impossible for you to function outside a structured educative environment or an academic environment. So that was quite hard, and yeah, so I didn't know what to do after that, because every day I would see Facebook, and I would have my friends who were getting married or having babies and going into MD or MS, and I didn't really know what to do. And that's when I realized that I shouldn't stop following my dreams. So I'll just share how I got out of that situation. So the first thing is that you realize that you're very much on your own, because when you want to chase a dream of yours, and if you don't want to give up on it, you really have to understand that there's nobody else who can help you attain your dream. It's just you. It's you. You've got to stand up on your feet, take up the responsibility, and chase it all. And there's no use of trying to get shortcuts, because in the end of the day, the shortest way really doesn't matter. It's your experience and how hard you work to get it, which makes it happy in the end. And I don't really think there are a lot of shortcuts in life, so I don't really believe in it. So I don't think there are shortcuts. Yeah. And the next is to really get outside your little bubble. It's to push yourself, push your boundaries. Like how Shilpa said, it was a great presentation, Shilpa, great experience. And how she says it is important for you to push outside your boundaries and experience a different something which is outside your comfort zone. And the next thing, which was the most important for me, is to escape the waiting place, which is basically that there are points in our lives we tend to wait things. You tend to wait. Maybe there's a better offer which will come along. Maybe there's something which is better. You wait, and maybe you think maybe this is not the year, or this is not the month. Maybe next time. I'm not telling you to take the first thing which comes along, but don't stop. Even if every day is a day you can progress in something. So it can mean just reading an article. It can mean listening to a podcast, or reading something, or writing something. But keep yourself busy. Every day is one step closer to your dream. So don't stop and say, you know what, I'll take a pause. No, sometimes it's best to, every day is a day of progress. So it's important to not lose hope and keep going. And then, of course, it's also important to know when to let go of some of the dreams, which might seem not very practical, because I have a lot of dreams, and most of them are not really practical, or not reasonable, I would say. So it's important to know what to let go and what to keep on, and what you keep on, never to let go, basically. So at the end of that, I really realized, so that was in beginning of 2017, I realized that I wanted to do my PhD, because I wanted to really pursue research, because I was not very happy with I was very traumatized with the mortality, what I experienced with Ebola in West Africa and the conditions. So I wanted to look into the emergence of diseases, the emergence of viral diseases or emerging diseases, which was really what I was passionate about. And so that's what I did. So I had a choice between two universities. One was Mount Sinai in New York, and the second was was another PhD offer from an Institute of Sustainable Research in France. I took the one in France because it was something I was very passionate about. It was very much on emerging infections. And then there was the fact that you get to travel to a place in the Amazon. As I said, it was, again, for me, was pushing a bit of the boundaries, which I really like to do. So that's what I did. So I took a year. I took the PhD offer from France. And so I was in French Guiana, which is, as you can see, it's a part of the Amazon. This is a picture I took when I started my field work in French Guiana. So it was a new language, of course. Everyone here talks French, and it was really fun. Everyone is very kind, and they really help you to learn a new language. As Shilpa says, it doesn't take very long to learn a new language, and it's a new culture as well, which is a little bit more difficult. And the thing about a PhD is it is very much publish or perish. So you've really got to keep up and publish. That's the thing, It doesn't matter whether you do your PhD or whether you're in your Mbbs or whether you're doing your MD or your MS. It's important to publish. Whatever you do a case study, a case series, a randomized control trial, publish. Don't keep your results to yourself. Even if your results say that your model did not work, your statistics were wrong, publish it. It's fine. Let the world know that this model doesn't work, or the statistics doesn't really work for this particular data set. So what my PhD was about is basically to look into the emergence of diseases with the environment, with the natural environment. So looking into climate change and how it can increase diseases, looking into how deforestation can cause epidemics across the world. So I got to work with a lot of diseases in French Guiana, and right now, of course, with COVID. And it was very, very interesting, of course. So I got to finish my PhD in 3 years. So it could take longer. But as I said, if you have a very good publication rate, it's okay. I mean, you could do it in 3 years. And it was worth every minute of it. And I would never regret to have done my PhD. And so following my PhD, it was very easy for me to get a new job, mainly because it's COVID and that's what I'm specializing in, emerging infections, emerging viral infections. So it was easy for me to get a job just after finishing my PhD. So I got a job in the University of Bern in Switzerland. So this is what I do. I model, I simulate areas of disease emergence. I identify hotspots, and so with these simulations, what we do is we can see is there going to be a new emergence of disease. For example, with COVID-19, we get to see in the hospitals in the area, which hospital is going to have a higher caseload this week, and what can we do to divert caseloads? What can we do to control, prevent, and also with antibiotic resistance. So we do a lot of simulations to have a protocol, a solid protocol in national programs and for WHO as well. And of course, the most important thing I do is very much with the environment. So I look into how climate change every year is affecting, increasing the amount of emerging infections and which regions are at risk with climate change and emerging infections and deforestation, etc. So the best part about what I like about my job is the fact that I get to go to the field as an epidemiologist, because that's something I really like, to be in the field to work. So here my field is, of course, in South Africa, so what kept me going? I know it's quite a long route. It's not very straightforward, but what kept me going all these years is very much my passion for emerging viral diseases, and I think that makes all the difference in someone's career. Thank you very much. I will pass the mic on to the organizing team for the questions.
Yes, thank you, ma'am. Audience, do you have any questions? It can be directed to the chat box, where it will be conveyed to our panelists by our moderators.
No questions yet?
Audience, do you have any questions? So the question is, how do we get scholarships from abroad universities?
So Aparna, I think, it depends on what type of scholarships you're applying to. For example, for a postgraduate, so there are a lot of scholarships. It depends on which country you're getting to or going to, and what exactly you want to pursue. So, for example, in my case, the Liverpool School of Tropical Medicine had a scholarship for people from the Commonwealth countries. So that includes India. So I got a scholarship because I was from a Commonwealth region, and as well that I had grades, and I had good grades during my MBBS. So that helps. So that is mainly how you get scholarships. And the second thing, otherwise, there are also scholarships like the Chevening Scholarship, and then and I think in the US you have scholarships like Fulbright. It's a fellowship more like. So, so it depends on the universities, and you can go into the university website, and there is usually a link towards scholarship. There's a page on scholarships and what you can do to get scholarships and what are the things required. So how do I know if there was a existing scholarship at that time? It was basically I went into I knew I wanted to do something with infections, viral infections. So I went into the Liverpool School of Tropical Medicine's webpage, and I looked into the scholarships they offered. So I applied for the scholarships when I applied for the master's, and that's how I got to know about it.
The next question is, how can I be a scientist after MBBS in India itself, or should I migrate? And if migrating, for becoming a research fellow, are licensing exams required?
Well, if you want, in India itself, I think ICMR has a lot of opportunities as well. But to tell the truth, I'm not very sure about what are the conditions with being a scientist in India, because I wanted to leave India because I wanted to work in a very specific niche that is with emerging viral infections, and that's why I did not want to stay in India, because India has scholarships, very good scholarships, but it's very much localized towards tuberculosis and HIV mostly. That was in my time. That was in 2014, but I'm sure things have changed right now. And so it depends where you want to study. So you can study in India, or you could also go abroad and then come back to India. And then if you're, what are the licensing exams required? So I took my MRCP to go to the UK, but I really did not need it in the end. So I took a lot of exams because I was bored, and after finishing my internship, and I had some time to finish. I had some time before I joined my master's, so I had around 9 months time. So I decided to take a couple of exams, but you do not need licensing exams to go into the research field usually, unless you want to be a researcher with clinical trials, but that depends as well. Now there are less and less need of licensing exams for becoming a research fellow.
Saushita, can I add a little bit to that?
Of course.
Yeah, thank you. So thank you, Saushita. That's a great talk, and I really enjoyed it. I know how you started, like in your first year, and like how we used to chat about the options and things like that. Yes. So just to add to what Saushita said, she rightly pointed out to the scholarships in the US. The Fulbright offers master's level scholarship, but the only condition is you need to come back to India. So, but they pay your fees fully. So you need to go into USIEF. That's a website, United States India Education Foundation, it's called, USIEF website. So there are master's scholarships, there are even PhD scholarships which you can pursue. And it's a very competitive process. It goes through like multiple levels of interviewing and applications and things like that. But yes, it's still worth it. That's one. And if you want to go to countries like Germany, which is the hot place right now, because the scholarships the PhD scholarships are fully paid for. Like any PhD you get in Germany, it's fully paid for. You're assured of a scholarship. So you need to go into a website called DAD, D-A-A-D, DAD. So they have all the opportunities for PhDs. As far as India goes, there are a lot of centers which has opened up now. One is the Public Health Foundation of India. So if you can go to that website, they have opportunities. It's spread over all parts of the country, east, north, south. In the south, it's in Hyderabad and Bangalore, and it's in Assam, and it is also in Delhi. That's a head office. So you can pursue a PhD from there, or you can even work there as a research fellow to gain experience. And there is also masters in public health. So MPH programs which are offered through many institutes. And if you are really interested in research after your MBBS, you can come to PSG. We have a big lab and research facility where you can work for some time and gain exposure. So these are the opportunities, but within India, you need to do a PhD. So if you want to pursue a research career in India, you need to do a PhD or at least a postdoctoral fellowship, which you need to do in some specialized area, like how Sarshita is doing. So you need to do a specialized fellowship in a particular area. So whether licensing exams are required, it's up to you. As she said, if you want to go to the US, the shortcut usually they follow is like trying joining an MPH, Masters in Public Health. The next speaker would talk about it, but still just a small intro to it. So MPH, and if you want, you can pursue your licensing USMLE. Many of our students have done it, and same with Canada. So Canada is also opening up. A lot of PhD opportunities are there for those who are interested. So if you have to go to individual universities and look for opportunities, just like Shaushita said. Yeah, so thank you.
Thank you, ma'am. Participants, do you have any more questions?
I'm just going to add on a little bit to what Ma'am said. Thank you so much, Ma'am. Of course, if anyone has any doubts, I think Ma'am is the best person to go to when it comes to research. I had a lot of help from Ma'am during my BBS, and she's the one who inspired me to go into research. Thank you, Ma'am, for that, and Sarah as well. So just to comment on the PhDs in Europe, in the European Union, all PhDs are paid. So you're paid a good salary and a stipend, more like, and then you are paid. And if you have a family, you have allowances for your family as well. Yeah, thank you.
Thank you, ma'am. Audiences, do we have any more questions? If we don't have any more questions, we move along to the next speaker. Thank you, ma'am.
Thank you very much. Thank you, Sudha ma'am, and thank you very much, AXON organizing team, for inviting me. It was a pleasure. And good luck to everyone in the session, joining the session. I hope you get to follow your dreams.
Incidentally, it's Saushita's batch which gave the name AXON, so it's very special to her.
Yeah.
Right?
Yep. Yes, very much so. It seems like a long time ago. Thank you, ma'am. Thank you very much.
Yeah.
Thank you very much, ma'am. Next, we have with us today Dr. Sadishnam. Dr. Sadishnam Balasubramanian is an epidemiologist who leads the Global Health and Development Team at Scope Impact and oversees the public health projects, M&E, and clinical work. He did his MBBS from PSG IMSR and his MD and MD in community medicine from JIPMER and MPH from Johns Hopkins Bloomberg School of Public Health, specialized in epidemiology and biostatistics. Prior to Scope, he was CIFF and GHPAGO, leading their M&E work in India. He was instrumental in expanding the portfolio, new business development, and operations of the organizations. He has academic, public health, and clinical research experience and multiple peer-reviewed publications to his credit, and has more than 15 years of experience in maternal, child, neonatal, adolescent, and reproductive health, non-communicable diseases, nutrition, child protection, digital health monitoring, evaluation, and research. We welcome you, sir.
Thank you so much. Am I audible to you?
Yes, sir, you're audible.
Okay. Thank you so much for this opportunity. I think I sound quite ancient if you say 15 years of experience. But I think over the years, we started in a year where there was very less of information technology, but we have just, there's a boom now with so much of information rightly available. But I have collected some wisdom throughout the years through the journey. So I'm going to present to you how the journey has been and how certain decisions we had to make in the career path. And then I'll be also happy to answer your questions. So I'm just sharing your presentation now. So I would just like to call this as an outlier journey of an average student, because I consider myself very an average person. But this journey was a very different journey because everybody, when I did MBBS, was all towards clinical subjects, but I took a very different path, and I'm really happy about it. But I would also like to say that it is different because I don't live the same life every year, every now and then. So that's how it's an outlier. I've used statistical terms here and there. So just to say that I've been part of research, and this is also an UG research conference. So what are the dilemmas in career path? What hypothesis to choose, the null or the alternate? One side you have your dream. One side you think about what is practical for you. As a student, you always think about what to balance between dreams and reality. Whether you want to be rigid or you want to be flexible is another question. Whether you want to be the same or you want to be different. You want to do just the same clinical things which others do, or you want to be different. This is also a dilemma you have. And whether you want to be in your comfort zone or get into a challenging zone. But it is of your interest, but just move out of the comfort zone. So these are some of the dilemmas even I had when I did my MBBS. The MBBS all started here. It's all now, once upon a time, it's been like 25 years when since I joined PhD IMS. At that time, to add an interesting note, when I was doing my MBBS, Dr. Sudhir ma'am used to be in pediatrics rather than in community medicine and research. So maybe I was taught pediatrics. I was one of the few who was taught pediatrics rather than community medicine at that time. And I was all like some of you really thinking about what to do, how to like really compartmentalize my brain, and also thinking about whether this is the right decision I have taken. Being in MBBS, I need to sit with a cadaver every day for 3 hours and do the dissection. It was a different world. Nevertheless, to say for every medical student, there is a mix of all these symptoms you get right from the first day, like phobia, dysphagia, ptosis, nystagmus, migraine, amnesia, especially in exam halls. You need to like aphasia when you have a viva, and you have got the spectrum of mental health issues. That is the normal of a medical student. I also underwent that. At the time, we didn't have a lot of exposure about what we will do. It's more about getting into a clinical PG. That is what we all did. So at the end of the graduation, 5 years of studying, I'm still alive. I was very relieved that I was alive after 5 years. Very proud to be a graduate, but just to realize that MBBS is not the end. But we didn't have a lot of options. We didn't have so much of information technology to explore wherever you have. So what next? This is a kind of algorithm. People used to like really ask us few questions and then say which one would you would like to. And I, to be very honest, at that point chose want to be a pediatrician. So maybe inspired by few people like Sudha ma'am at that point of time, and we had a really good pediatric team in our college. But what really happened was different. It was from pediatrics to population health. It's more like a statistic to a parameter. If you know statistics well, it's more from an individual level to a population level. This was by, I would say that entering MD was like really by accident. Really by accident, because repeatedly I was applying for pediatrics. I was not getting through the entrance exam. Maybe I was not very comfortable, though I was a literally good student, but entrance exam was not my cup of tea. So repeatedly I've been getting community medicine. First I got an AIMS, next I got an PGI, but I just rejected at that point of time. But later again it came back to me again at JIPMAR, and I just picked it up. At that point, I think Soumya Swaminathan, who is our chief scientist at WHO now, she was a person who, like, along with her team, she pushed me into this, saying that if you want to just treat one patient, she was also a pediatrician. She inspired me because she felt that instead of just focusing only on clinical medicine, if you focus on public health, you can save more lives, you can save more children, and that's why I just picked up that and MD community medicine. But I had this question a lot from all my classmates. Everybody I met asked me this: why did you choose this major? What is there in public health? Is it just by error you have chosen? This is not your arena. This is you're a good clinician. It doesn't give you a clinical experience. But it all depends on how you look at public health. People differently think public health because most of them do not understand or think that you don't understand. There are different ways people perceive you as a public health student, but it also depends on how you perceive yourself. So I was initially very hesitant to be a part of AMD, but slowly what interested me was epidemiology. Epidemiology is something very different in undergraduate. It's taught very different in undergraduate. But when you really read some of the texts and some of the applied aspects of epidemiology, when you really go to the field and do kind of an infectious disease outbreak, or you keep tracking of maternal mortality, it's completely different. So that really triggered my interest, and it totally shifted me towards community medicine. At the end of 3 years, I think I really wanted to be one in the public health. But immediately after that, opportunities I had to choose because I was not in a position to go abroad at that point of time to do any of the masters or PhD. So I wanted to like really become an educational rock star for some time, like many of your teachers and many of our teachers in PhD. It's just to build our confidence. And I used to teach MBBS masters as well as PhDs and MPhil students. I also used to work at Shankar Nethalaya teaching research methods at that point of time, which I'm still doing, of course. But that always had a building confidence in me, but also gave me the space and time to think what's next. And I said, this is not the end, because every day, if you look at it, people come up with a random association. Which made me really think that this is something which I need to explore and be very clear about. Let me do a master's in epidemiology and biostatistics. At that point, I had 3 choices. I got through in 3 big universities in the 4 universities in the US: Johns Hopkins, Harvard, University of California at Berkeley, and also University of North Carolina. University of North Carolina. So all these schools are the best schools, but I chose to be at Hopkins just because it was the best place for epidemiology, and it had the world's number one MPH program. I really wanted to be there, and it completely changed my perspective about epidemiology. Previously, I used to just think about data and what data says, but it really gave me a different perspective of how to look at data. It's just not what it is revealing, but not what it is concealing. What the data does not say, that is something which I was like started looking at. And also being very patient in the approach of looking at data. It's not that you just look at data and come to conclusions. You really analyze it, come to a conclusion, and also look at what can be the practical applications of it. So that was my stint in Johns Hopkins, and then I came back. I really changed some of the things. I started teaching applied biostatistics for research students. I think one of the very few at that point of time in 2007, 2008, 2009, where people started thinking about like teaching SPSS for research students who are not epidemiologists, and completely applied biostatistics, no formulas intended, like just more on the application side of it. I'm still proud of that team. Like we have around 20, I have around 25, 30 students from each core, like from then on till date, who can analyze the data, who analyze data for a number of world renowned projects in optometry and ophthalmology. And it's all because we started about applied biostatistics at that point of time. But it also says that when you look at data, I just want to say this as researchers to you, like please don't keep on analyzing your data or try to convince that it is like something is working. Because if you torture the data long enough, it will confess. So this is something which I've learned in the past. This is not a career, this one, but if you are taking a career option in public health, please ensure that you do data analysis to a level and then stop as planned. Don't go beyond that and keep massaging the data. This is one of the learnings which I'll always like to share. But teaching was not very sufficient for me because I want to apply it to a larger level. So that is why I really wanted to get into the social development sector, which also includes public health. Johns Hopkins again gave me an opportunity to lead their monitoring and evaluation team at Jhpiego, and I was very happy to be monitoring and evaluation team leading it. I started with a team of 4, but when I left Jhpiego, we had a team of 40. We had expanded from a couple of projects to about 20, 25 projects, and we really expanded. I was a part of a number of things which I will be sharing with it, but more than that, it gave a real practical experience, learning about Jharkhand, Bihar, Uttar Pradesh, Uttarakhand, northeastern states, Maharashtra, any state you name. I worked as a part of the teams there, which gives a depth of diversity in India and also understands how health system really differs. All these experiences really mattered. For me, the variables and groups I came across are like really huge. I'm not going into depth of it. It varies from a very clinical maternal and child health, where I worked on quality of care. For Indian government, we have this program called Dakshata, and now it is also called Lakshya. This has evolved all because our team's work, which talked about quality of care, to expanding the national soil transmitted helminth program, which is in a huge space, which happens every year, twice every year, where about 250 million children are being dewormed. And to right now, I'm with Scope working on how to like restore immunization services in Nigeria, where everything is stalled because of COVID-19, and also or look at what can be the best indicators for emergency obstetric care throughout the world. So these are some of the things I've worked, and these are some of the significant associations I had. I had opportunities to work with the government of India, working for the monitoring and evaluation framework, designing the indicators for many of the programs. I got an opportunity to be Harvard maternal health mentor for a candidate, being PhD examiner for a couple of times, being a soil transmitted helminth scientific committee member at the national level. I have been part of Johns Hopkins curriculum committee, or also at JHSPH, I've also been part of their IRB review committee for quite some time. Still, I teach applied biostatistics and advanced AP and scientific communication at Shankar Netralaya. Yes, every year I conduct a couple of workshops there, and I still have students who like really participate from all over India for those workshops. So this has been my journey, but everything I'd say that I always had dilemmas in that, whether to really take community medicine or not, whether to do a master's in public health, which university to choose. And more importantly, when I wanted to take a real important career break to Johns Hopkins, I had a dilemma whether to take a PhD or not. I had a funded PhD in adolescent epidemiology at University of Pittsburgh. but I chose to be in the career path because I felt that I want to be close to the field, to gain more experience and help people rather than being in the academic sector. That is like completely my choice at that point of time. But what I want to say is that there are always possible best fit for you for pathways. In public health, at least, you have a lot of opportunities coming up in climate change. It's a huge area for public health professionals. If you take a public health nutrition, always growing field, health economics, disaster management, especially with more expected pandemics and natural disasters. This is going to be an important field. Public health informatics has been like really growing with so much technology, especially in artificial intelligence and machine learning. And there's always a need for epidemiology and public health managers in this area, which I've been like really sensing for the past 15, 20 years. I don't know whether this will be useful, but this was really helpful for me when I choose a career. Be really balanced between what is your dreams and what is realistic, what can really happen. Sometimes everything what we think may not happen, so you need to really balance it out and think strategically what will work for you specifically, and never be hesitant to be different. People may really say why you're different, but today I think when I'm standing at this point with another road less taken, there are some of my classmates who still ask me what can be my career path and way forward, because you took a very different field. We are really not liking what we took because it's the same thing which we have been doing. But I really got opportunity to do very different things over the past 20 years or so. I'm really happy about it. Most important of all, always have your contingency backup. Never have a plan A and stick with your plan A until things work out. Have plan A, B, C, D if possible. And that will be really helpful for you, because always plan A doesn't work for everybody. And we should have our backup, but do within your dreams as well. Like it's really a balance about your contingency and what is your dream is. And really all the best for all of you for your college and your career. And I'll just stop here and I'll stop sharing my presentation. I'll be happy to take up any questions.
Thank you, sir. Participants are welcome to ask any questions or doubts they have.
Thank you, Sudarshan. That was great. Very nice journey you have explained.
Thank you.
Can relate to most of it because I went through the same dilemma from being pediatrics to community medicine.
Yes. Okay. Right, I think somebody has asked me a question, is USMLE needed for MPH? So USMLE is not needed if you just want to do an MPH. It's not mandatory. GRE is mandatory in US institutions for your this one, and also you have your application, statement of purpose and recommendation letters, and you may have to get your transcripts verified. So that is also mandatory. USMLE is not mandatory, but if you want to get into a residency program after your MPH, which people do, then USMLE is mandatory. Otherwise, no. If you want to get into MPH and PhD, USMLE is not mandatory. You able to hear me?
Yes, sir. Participants, do you have any more questions? Sir, the question is, what is the path that can be followed to join the job opportunities provided by the WHO in public health sector?
Okay, so WHO has like various kinds of opportunities. One is at the regional office level, which is like Indian office level, as well as the Southeast Asian regional office level. So for that, first you need to really have a kind of experience they are expecting. The easiest way of getting a WHO job used to be like the polio surveillance program. We do have some opportunities coming there, but now it is evolving into more in measles and other infectious diseases. Those surveillance officer programs is a like really good way to start working with WHO. But apart from that, they really want a different skill set. They want a different kind of experience, and also some of them require you to know a couple of other languages at a basic level or advanced level. It's very specifically written there in every opportunity. If you just go to who.int, they have all the opportunities in their web page. You can create an application anytime. Even as an MBBS, you can create an application there and keep looking for opportunities. And when there is an opportunity, you can always apply for it. They'll be kind enough to at least reply back whether you're selected or not. But I would say whatever they say they require, they'll usually require for it. And WHO as part of my public health experience, WHO is not really the endpoint. It's really good to work in WHO, but you can really really do good impactful work even if you are not at WHO.
So the next question is, like studying from an Indian university, what were the challenges you faced in Johns Hopkins?
Okay, there are some challenges which we like really faced, and some of them were really good because we have Johns Hopkins University is like it's a 10-month program, but and it's at 5 terms, so each term is 2 months. Imagine that two months is like a semester. It's like a 6-month program which is compressed into 2 months, and you need to complete about 20 or 16 to 20 credits. That is about 4 subjects, which is like and you have a midterm, your pre-midterm, post-midterm kind of exams, and then your final. So it's like you are always running. And you need to be careful of the grades because if you want to apply for a PhD program, you need to be really good for look for good grades. And my mentor, unfortunately, was from Asia, and he said, you can't enter my room unless you get a grade GPA, that is a grade point average of 4. It's very difficult to get a grade point average of 4 when you do courses like epidemiology and biostatistics. I said it's like one of the toughest courses in the world. But it's like really you run every day. Every day you work hard. It's not very new for us. That is for sure, because you've been doing it from your days of MBBS, or if you do an MD, but it is very focused. It's very specific. And the second thing which was very different in the US universities, which I found, was people were very casual. There was no attendance, first of all. Attendance was not at all mandatory for most of the courses. So it's up to the student to attend and gain the knowledge. And you can really stand up in the middle of the class and ask your professor, call your professor by his first name or his nickname, and then say, I don't agree with you. And most of them like took it in the right sense. Of course, there might be 1 or 2 odd people there, but usually that was very different for me. The grade point average was very different for me, and it is like the 10-month compressed program was different because we are all used for a yearly exam, maybe kind of different kind of exam pattern at that point of time at least. But I was successful. It's easier for Indian students because we are used kind of any kind of learning, I would say, whether it is conceptual learning or whether you need to like really get it verbatim. Everything we are really good at it, so it was not very difficult. At the end, I had a GPA of 4 at the end of 10 months. So it was not difficult, but it will be tough for you to adapt because we are not used for such academic settings.
So the next question is MPH equal to community medicine or separate residency is available?
So MPH is not equivalent to community medicine. They also have preventive medicine and public health residencies in US, but for that you need an US MLE. Not many places provide that, but you have a degree for that. For that you need an US MLE. But if you take that residency, MPH is also part of it. Some of your credits from MPH you can definitely use in many of the universities. Hope that answered the question.
Participants, do you have any more questions? So the question is MPH equal to community medicine or separate residencies available when India becomes developed, scope of community medicine decreases?
Okay, so scope of community medicine will never decrease because you have newer challenges. Today you have COVID-19. COVID-19 is really going to boom the need for public health professionals in India because we need to really set the system right. People are have started thinking, the Ministry of Health has started thinking in those terms. So it's not going to reduce. You're going to have dual burden now, emerging diseases, non-communicable diseases, and you also have a lot of issues which are still persistent in India. So I don't think it will stop. Even if India becomes developed, it has not stopped in developed countries like US, China, Singapore, any country you name, public health has not stopped. It's really increasing demand because there are newer challenges, there are newer diseases coming up, there are lifestyle changes, there's climate change. So it's not going to reduce anytime. At least in my lifetime, I don't see that.
Any more questions from the audience? Make use of this opportunity. We're all well experienced and highly professional panelists, so make use of this opportunity to clarify your doubts.
Participants, do you have any more questions? If that's all the questions we have, thank you very much, sir, for sharing your valuable experience with us.
Thank you very much for this opportunity and considering me for this panel. I think it's a real good experience and happy to be always there at PSG, whether it is virtual or in person. Thank you, the entire team, and especially Sudha ma'am for this opportunity.
Thank you, sir.
Thank you, Sudha. Yeah.
Now I'd like to call upon Dr. Sudha Ramalingam, Director of Research and Innovation, PhD Institute of Medical Sciences and Research, to address the gathering.
Well, thank you. I don't know if there are any gathering there because it's all virtual, right? Okay. So first of all, I just like to thank the organizers for putting together this excellent, panel discussion. So mainly when we started planning the program, one thing which came up to our minds were how to decide the career path. So that is an eternal dilemma from my time. So always we are in crossroads, how to decide which way to go. With the current level of competition and so many competitive exams, it's really tough because we don't know what we are going to do and where we are going to head. So one thing is we gathered these panelists because they chose unique career paths. So one is in an army and one is doing a PhD in climate change and emerging infection, and and Dr. Sudarshan is a leading, policy maker and administrator with public health experience. So we thought like it would be a good panel for us to interact and come up with certain points. So as a personal experience, I would like to, just compliment to what they said. So as Dr. Sudarshan said, I was in pediatrics. So I did my DMB in pediatrics. So you may be wondering what happened to me. Why did I jump to community medicine? There'll be a lot of regulatory changes as you go across or, as you type through this career path. So what happened when I did my DMB is that after my DMB, I went to US. I did a fellowship in genetics. So, that was a big deal for me because as Dr. Sudarshan said, how he experienced Johns Hopkins, I experienced Stanford. So that was a totally different ball game altogether. That was a big turning point in my life, I would say. But when I returned to India, what happened is unfortunately DMD was not recognized at that point of time, nor did the fellowship which I did in the US. So I was a tutor in the community medicine department. But earlier in my college days itself, I had only two career choices. One is pediatrics and the other is community medicine. So I had to do Indian degree, quote unquote, like Indian degree to be able to work in an academic institution. So unfortunately, that's a system that we have. We need to have academic degree, either a MD or a DMD. Now DMD is recognized, but in those days DMD was not recognized. So I had to do an Indian degree. So whatever is close to my heart other than pediatrics is community medicine. So I did community medicine. So I never regret what I did, the choice that I made, because that has made all the difference in my life. So as Dr. Sudarshan said, you get to see the larger perspective of things and it will never go out of fashion because there's going to be a lot of communicable diseases, a lot of non-communicable diseases, climate change, environment, and so many things which you can play a big part and make all the change that you would like to have. And what is important is have a focus. So don't go behind the herd like, I want to become a pediatrician, I want to become a gynecologist. Like, it's not, that's not the end of the road. There are other ways to ascend up the career. So have a focus, start working towards it from now onwards. So you are in second or third year, so start working towards the goal now itself. Don't always think being a clinician is the only way you can help the mankind, being a doctor. There are so many other ways in which you can help the mankind being in the medical profession. So you can become a medical educationist, you can become a public health person, you can become a policy maker, you can become a researcher. So many career paths are out there. So if only you can just open up your mind and expand your horizon, especially with the way of information that is available. So there are a lot of doctors who I know, I couldn't get them now. Some of our own students will become entrepreneurs. So they have a lot of startups and they become big, very successful in terms not just in terms of career but also in terms of money. So one of our own students, earlier batches, he went to the US. He pursued masters. After his MBBS, he pursued his MBA, and now he's a very successful entrepreneur in the US. So there are a lot of career paths, not just in the US, even in India. A lot of artificial intelligence, machine learning, and so many other opportunities. Large data is becoming a big, in thing now. So after your MBBS, you can even pursue a interdisciplinary PhD, which are available in IITs and other IICs, Indian Institute of Science, Bangalore, and several IITs. You can write your entrance exam and pursue these PhDs, which will give you a good, opportunity career-wise as well as monetary, money-wise. So just keep your options open. That's my sincere advice. So be ready to change. So there will be change in the regulatory system. So now you did not think you will have next, but now there is an exam called next. So similarly, when I did my DMB, I never thought I'll be forced to do another PG, which is big torture. Doing 2 PGs is a big torture. So after DMB, when they said it's not recognized, I had to do another PG so that I'll ascend up the career. So such things you should be open and give your best in whatever you do. So even if you take anatomy, or community medicine, which is often not so popular when compared to other specialties. I'm not demeaning the value, but the popularity I'm saying. So give your best. So be the one where you can make a difference. So when you are in community medicine, there are options are endless. So it's not what you see. It's not all about sanitation and mosquitoes. There are so many things you can do with community medicine. So similarly with other specialties as well. So keep your options open, eyes open, and be open to any changes that will come across in your way. Don't lose heart. If you don't perform well in NEET, it's okay. So there are always other options where you can give your best. So the inner core will not change, whatever is the specialty. So you have to develop that kind of personality and positive attitude towards your career and life so that you can succeed. So wish you all the very best, and God bless you all. Thank you.
Thank you very much, ma'am. With that, it brings us to the end of today's event, and I hope all our participants, it was very informative regarding the various choices in your practice and encouraging you to reach new horizons. I'd like to take this opportunity to thank Dr. Sudha Ramalingam ma'am for helping us organize this event. And I would also like to thank all our esteemed panelists for sharing their precious time with us, and to thank all our participants for joining us today. Thank you. With that, we are ending our session. Thank you for joining us today.